Okay, it's 10 a.m. Let's call this October Health Committee meeting to order. Counselor Callison, would you do the invocation, please?
Our most kind, gracious, and righteous Heavenly Father, we thank you, dear God, for this opportunity and privilege to call upon your name in prayer. We thank you, dear God, for bringing us as counselors together, dear God, to take care of the Cherokee Nation's business. Be with us, lead us, guide us, and direct us as we do this, dear Lord. Bless each and every one that we represent. Be with each and every one of us. Give us a safe journey home tonight, dear Lord. Bless each and everything that we do in the next couple of weeks. Bless us all, and please bless the Cherokee Nation. In his name we pray. Amen.
Thank you, Counselor. Shelley, would you conduct the roll call, please?
Yes, ma'am. Sasha Black Fox Qualls.
Here.
Ashley Grant. Danny Callison. Julia Coates. Joe Deere. Kevin Easley. Uriah Grass. Lisa Hall.
Here.
Clifton Hughes. Johnny Kidwell. Daryl Legg. Kendra McGady. Dora Patskowski. Cody Poindexter.
Honey.
Joshua Sam. Melvina Shotpouch. Kendessa Teehee. We have a quorum.
Thank you, Shelley. You've had a chance to look over the September 5th, 2025 regular session meetings. Do I have a motion to approve? Motion. Second? I have a motion and a second. All in favor? Aye. Any opposed? Motion carries. Moving on to reports from Cherokee Nation Health Services, we have Mr. Wayne Caldwell reporting.
Good morning, Council. Thank you for having me today. I have 3 quick updates I'd like to provide you that is outside of the packet that's provided there. The first thing I'd like to hit on is our 2025 vaccine efforts. We had a few weeks of drive-through efforts that we hosted at the local health centers, and we had a great year. This year we did include the Claremore location in our efforts that took place. We wrapped those up, I believe it was last week that we did, and we did a little over 6,000 vaccines through those drive-throughs in that week's time. I'm very proud of those efforts, and I know the public health team is out and about as well. I know Lisa will be hitting on that. One key note, that you can give your constituents or maybe just for yourself as well, is patients can continue to come into the health centers and receive their COVID and flu vaccines, whether that's a walk-in or a scheduled appointment. Through the duration of the season here. So just wanted you all to be aware of that. Great efforts that took place. Takes a lot of team members to pull this off. And it was another year of success of getting our patients vaccinated. The next point I would like to hit on is something that I'm excited about. It's our pharmacy app. We're going to be rolling out an app for our pharmacy platform. About a year ago, maybe longer than that, we rolled out the new McKesson platform. A very familiar platform in the pharmacy industry. When we rolled that out, we were able to have the ability to roll out an app now. That app has many features on there. I'm going to hit on a couple of those. I'll probably create more questions than answers here, but there's more to come on this. A couple of key points from the app. It's an app that's in the Apple Store. Android users can also download this app. It is an app that basically allows patients to access their medication history, dosage, refill information at the palm of their hands. This app also will text reminders to you to say when you have 5 days left on your medication, do you want to refill this? And you push Y and it sends it and it goes out to where it needs to go. So this is a very positive thing. We're creating our patient information that we can get out to the public, and we're hopeful to have that out there very soon. Had some of my team members use it and said, hey, here you go, no instructions, see if you can get into it. And one of the gentlemen on the team responded back. I got in, I was able to refill my prescriptions, and if I can do it, anyone can do it. So that was a positive to hear. I think it's going to be a very good thing for our patients everywhere that need to offer this. They'll still have the option of picking it up. They'll still have the option to have it refilled. So very, very exciting. As soon as we have this material approved, we will be rolling this out to the patients, and we will ensure that we make sure all T's are crossed and all I's are dotted before we roll this out. So again, great thing. Last point that I'll hit on here, let me get organized again. I want to provide you a quick update on Claremore. 30 days into the operation of Claremore. Once again, I want to say thank you for your support and all that we're doing there. That would not be happening without the chief, deputy chief, and you as the council providing support there. We are currently operating at a 50% in regards to patient visits. In regards to the pharmacy, I know that's a very important matter that I was just talking on. We're full-blown pharmacy there. We're serving people. I was there yesterday. People were being served. The slight adjustments because they did not have the McKesson platform in Claremore prior to us taking over. So we've implemented that, and they're operating on that now for 30 days. Doing a really good job. There's great team members up there. We're still adding to our team there. I think the last that I heard that Dr. Harp and others presented is we're pretty close to being full with all our providers there. Again, there's some training that has to take place. So I'm hopeful for the next 30 to 60 days that we're rocking and rolling in Claremore and getting people served and to the care that they have deserved all along. So, Madam Chair, I have nothing more to report, but I'm happy to take any questions.
Do we have any questions for Wayne? Counselor Callison?
Yeah, thank you for coming, Mr. Caldwell. The diabetes that we talked about back in the summer, you guys were going to do some research and some different things. Is that report about ready to give to us that you found? Over, it would have been over dialysis and transportation to it and from. And I just wondered if I know you guys have been really busy with Claremore, and I appreciate Claremore, but I just didn't know if that had come out and I'd missed it or.
Counselor, let me follow up with you on that if you don't mind.
Any other questions for Mr. Colwell? Okay. Wayne, thank you for the report. I do have just a couple of follow-up questions. On the app, for that to stay live, will that be active with the current MedRec for that patient?
I'll follow up with you on that. I don't know the answer to that.
Okay. And also, do you have any information on the testing with AI with the providers that's being launched in our clinics?
Okay. I will follow up on both of those items for you.
Okay. And I think we had one other question. Counselor Grass?
Let me answer one of those, or maybe just a comment, and then there will be some additional follow-up that I'll provide you. On the AI, in regards to the provider pilot that we have been doing, it's been well accepted. The providers are really liking it. I think there's still some kinks to work out, and more to come on that, but I will follow up with you on that. So,
Thank you very much. Great report.
thank you.
And moving on to Cherokee Nation Public Health Service, Ms. Lisa Pivick.
Good morning. It's great to see all of you today. I thank Wayne for prepping us to talk about immunizations today. So Health has been a great partner. We are following up on all of their efforts that they're doing clinically, both in the clinic and the drive-throughs at the clinics. Our public health nurses and our community health workers are out in the field doing vaccinations. In 28 days, they did 77 events, and they will continue through the month of November and into December. And part of our mission, too, is to find those places that may just require that small people, a community that wants us to come out, and maybe there's not a ton of vaccines to do, but we can get out there and do those. So really appreciative of everyone for the partnership and the efforts, and I think the community health workers and the public health nurses are having a great time, too, meeting people and also connecting people with other resources. So that's been a pleasure to do. In our report, you will see a little bit. The only thing I wanted to touch on, a couple of things. One is our wings numbers continue to go up a little bit for in-person. As you know, we're moving into the winter season. So January through March, we'll pick it up late March. We'll have more races. We have some in November as well, but hoping to get more in-person to match. Even though we want to keep the virtual as well, we're hoping to get people out to do the in-person. There's a lot of evidence that people getting together and doing something together helps keep them in doing that and keep some consistency if they do it with loved ones, neighbors, friends, and so we hopefully can get more people in person. The wellness centers, if you looked in the report, you will see that this month, Stillwell, well, no, Mary L. Carson Center actually surpassed Marcoma in visits, which is kind of amazing because Marcoma stays pretty busy. But I noticed that they had little over 11,000 visits at the Mary L. Carson Center, so it's doing well. A lot of that too for the uptake of looking at who comes to the gym. When we get the new wellness center built for Tahlequah, there's going to be more space. And I think a lot of the issues with Stillwell is there's more accessibility, more space to do more classes and different activities. So we're really looking forward to being able to expand that here in Tahlequah as well. Salina is picking up, as well as Kenwood and Marble City, really focused on a lot of the community events, but also have the wellness visits in as well. So we're really pleased with what's going on with our wellness centers. The only other thing is just a thank you to, if you were able to attend or your constituents able to attend the annual Breast Cancer Survivor Luncheon. That's an annual event that's been going on for many, many years. I would say that if you had any other, if any of your constituents had any issues or any thoughts that they might have about things they would like to do during those luncheons, we'd love to hear that. Great presence and speech by Chief Hoskin. Really pleased, the constituents are really pleased to see that. So that is all I have in the report. If you have questions, please, I'm ready, I think.
Counselor Coates?
Hi.
Hi.
What do the immunization rates look like this year? Are they comparable to past years? Is it too early to tell? Do you have any idea?
Yeah, I think it's a little too early to tell right now because the vaccination events, they start in October, but they lead into the upcoming months. Some people want to wait a little bit to get their flu shot. I talked to many who said, I'm going to wait till November and different dates. So it is a little early to tell, but we're definitely going to work with health services to see if we've created more access and more vaccinations this year. It's a little bit more difficult to ascertain a vaccination rate for the reservation, as that involves working with the state of Oklahoma and the immunizations that they have, and then what's gone on in the private industry. So we're working on that. We're not giving up. Our epidemiology team has plans to get immunization rates for the reservation as soon as they can, get the details worked out.
Any other questions? Counselor Hall?
Thank you for that. I really enjoyed the breast cancer luncheon with other counselors here. My mom is a breast cancer survivor, and so I know how much that means to them. It is great to honor them, to see what they go through and everything, and their caretakers and stuff. But I do have a question. Does the senior and WIC EBT cards, do they expire November 1st? They have to use it by November 1st?
The summer EBT was sooner. I believe
Okay.
that was at the end of September.
Okay.
But yes, the farmer's market due November 1.
Okay, thank you.
Counselor McGady?
Thank you. I don't have a question, just a comment. I wanted to tell you, first of all, that my husband and I both received our flu shots. So thank you for that. And I also wanted to mention publicly that one of my constituents somehow missed her notification on the breast cancer survivor. And so I reached out to you, Lisa, and you and your team, as always, went above and beyond to make sure that she was taken care of. And I want to thank you for that very much. So appreciate you.
I'll pass that on to the team.
Absolutely.
Counselor Poindexter?
Yeah, I just wanted to compliment you and your staff at the Stillwell Wellness Center. They do such an amazing job. Everybody just loves them, and they're always smiling at everybody when everybody walks in. And the numbers are great. I think there's more people going to the Wellness Center than there is in the population of Stillwell. So
I think so.
I go there. I know I go there at 5 a.m. every day. I enjoy it, and everyone's friendly and ready to go. And I ran into a guy. He drives from Tulsa just to go to that.
You're kidding.
I think it's like every other day he drives from Tulsa just to go, because it's, and I've run into a lot of people as well. They're non-native, but they're residents in Stillwell, but they pay for memberships there
Yes.
because it's so affordable for the community. So thank you guys for everything you do.
Yeah, I'll pass that along to the staff. I have to compliment the staff and all the wellness centers. You can have a building, but unless you have the heart and soul of the people that work in it, doing the work And I'm very proud. They are all very committed, and they keep people coming back, make them feel at home, make them feel like they're part of a family. So I'll pass that on.
Counselor Grass?
I want to say thank you for the efforts in wellness. But again, emphasize what Counselor said over there. I've heard reports of the staff being so friendly and helpful in Stillwell with the folks that come in. So hats off to you guys and keep up the good work.
Great, thank you for that. Thank you.
Any other questions for Lisa? I'll just add, great report, but also on the breast cancer survivors banquet, to be in a room filled with so much strength, courage, and hope was very inspiring. And so thank you and your team for hosting and bringing us all together to celebrate one another. We appreciate you all.
Yeah, I'll pass that on to the team. They work really hard on all the events, so thank you.
Thank you.
All right, thank you, guys.
Moving on to old business, none pending. New business, none pending. Any health-related announcements? We have the drive-through flu vaccine event and diabetes awareness walk coming up on Monday, November 3rd at One Fire Field, beginning at 11, ending at 7 p.m. And the next meeting is tentatively scheduled for Monday, November 10th at 11 a.m. And I'll take one more motion. Got a second? All in favor? Meeting adjourned.